to our Friday COVID-19 update. We do these updates the first and third Friday every month at 2 p.m. Today we have Ron Moorhead with the Willits Chamber giving us an update on the Mascot Mendo. We also have Lucy Kramer from NCO giving us an update on their outreach activities. Our Public Health Officer, Dr. Andy Corin, as well as Becky Emery, our Department Operations Center Manager. With that, I'm going to hand it over to Ron Moorhead to give us an update on the Mascot Mendo campaign.
Thank you, Sarah, and thank you very much for allowing us to give you an update on what's going on with the Mascot program. We've delivered over 85,000 masks distributed throughout the county from border to border, thousands of sanitizer bottles. Both Sheriff Kendall and John Martier have stated that they have seen a noticeable decline in reports of non-mask compliance and attribute this in part to the Mascot Mendo program. We've had a robust and steady stream of social media messaging, both in English and Spanish, working in cooperation, obviously, with NCO, and Lucy will be talking more about that and their program to reach out to the Latinx community. We have a number of attention-grabbing videos that are launching on social media, kind of having a little fun and kind of a little interesting about the Mask Up program, because a lot of people are a bit upset about wearing masks, and we're just trying to make it a little more fun. We have a great little contest going on that if you post a photo of yourself and other people in front of our posters, in front of a business, and post those on social media. We have a couple of lodging establishments that are giving up staycations, so therefore obviously folks in the county, and trying to pay attention to that part of this situation too. We've launched a dedicated Mask Up Mendo website to give citizens and businesses a place to go to get more information, as well as get the application so they can get more supplies. And we're working on trying to get that delivered, but generally they have to come to the chambers to get the information. We want to stress that this is for businesses, Mask Up Mendo, but all businesses. You do not have to be a member of any of the chambers. So we're covering the entire county. Any businesses or organizations that need masks or sanitizer, please reach out to your chamber, and we'll work it out so that you get the supplies you need to help people mask up. The Mask Up program has been pretty interesting because not only it has been good about the mask up situation and lowering the enforcement situation, but it has also allowed us to reach out to the outlying areas, and we've developed a much stronger coalition of businesses within the entire county. And that has been a really great thing. Obviously, Mask Up program wouldn't be successful without all our great partners. And I can't name them all because there's so many right now, but certainly the supervisors, the staff at the county, Sheriff Kendall and John Martier and his staff there. And a big nod needs to go to EDFC for obtaining the supplies and helping us get it out to the county and the businesses. There's so many people that have stepped up for this program. All of us at the chambers are just really happy to see the cooperation that we've gotten from all the businesses and how much it has really helped them solve an issue that they've had, so that they are less confrontational with anybody. And there's so many people out there. We so appreciate all your help. And we're just so happy that it's being such a great success. Thank you.
Thank you, Ron. Now we'll move over to Lucy Kramer with NCO.
Hi, thank you so much. And that was a great update, Ron. Thank you. Yeah, I'm Lucy Kramer. I work for North Coast Opportunities, and I am managing the mask awareness program within NCO. We began this work in August of 2020, so we are a relatively new program. Our contract with Mendocino County is for COVID-19 awareness and education, and our priorities are to encourage folks to wear masks, as well as adopt other COVID prevention strategies. So our top priority is getting people to wear masks, encouraging the adoption of mask use. We're also encouraging folks to socially distance, sanitize, stay home whenever possible, and get tested. Top priority, wearing a mask though. So we are a team of 10 people. There are 10 of us working to direct this program. 4 of the people on our team are fluent Spanish speakers. 4 of them are fluent Spanish speakers, and 1 is conversational. We are also working closely, as Ron said, we're working closely with the Chambers of Commerce, which have a comparable mission and objective. Although their target is businesses, our targets are local community members, especially those who are most vulnerable to the pandemic, which includes our Latinx community members, and also youth, which is people under the age of 34, and tribal communities. It's really important to us. We've taken great lengths to ensure that our programming is both culturally relevant and seasonably relevant. For example, with the upcoming holiday weekends, we're working to prevent an outreach following the upcoming holidays. To ensure that we are being culturally relevant, we have worked really closely with the Latinx Alliance, with Ucaya Vecinos en Acción, and with the Latino Coalition, as well as, we've worked some with Jackie Orozco and El Punto. And we're constantly open to hearing feedback about how we can better improve our programming and our outreach. So, throughout the course of this pandemic, there's been a lot of information coming from the top down, and that's amazing. We certainly need to hear it from our public health officials. Thank you, Dr. Corin. Thank you, to our local leaders. We see our role at North Coast Opportunities as empowering the grassroots efforts of our local community members to normalize taking this pandemic seriously and normalize adopting prevention measures, normalize wearing a mask. So, so the first thing that we did when we took on this contract was established a mini grant program so that we could invest in our local grassroots organizations, as well as some local leaders. We currently have 13 grantees throughout all of Mendocino County who are doing that direct boots on the ground outreach, education, distributing masks, distributing resources, distributing information, and again, normalizing COVID prevention. Our grantees, let me just double check my notes. So as I mentioned, Ucaya Vecinos en Acción, the Alex Robach Center in Ucaya, KZYX, Action Network on the coast, the COVID Response Network, Gregorio Prieto and Olivia Zamora are making a documentary specific to the Latinx experience of this pandemic in Mendocino County. I'm really excited to see that. I think it's just incredible what they're doing. I mean, all of these groups, I'm really impressed with the work that they're all doing. We're also working with the Volunteer Network of North Coast Opportunities, Gardens Project, to distribute masks and information through their existing channels of community gardens, which are primarily, the gardens are primarily owned and shared by Latino community members. Where other granted projects include Flockworks, Consolidated Tribal Health Center, the Willits Elementary Charter School, Bonnie Lockhart and Mayo Marufo are doing an incredible project as well, and the Sherwood Valley Band of Pomo Indians. So it feels really good to be empowering those grassroots organizations. It feels like, kind of like what Ron shared about this galvanizing our networks of communication between businesses with his work. This also feels like a really extraordinary opportunity to be empowering other grassroots organizations. So that's been really wonderful. We likewise are also distributing masks, and in the past 2 months, we've distributed 20,000 masks throughout our county. Each of those masks that we distribute include COVID prevention information in English and Spanish. We also have developed a website. That website is, it's a web page within Healthy Mendocino's website. On that website is information on our mini grant and bios of all of the mini grantees, as well as a resource bank for COVID prevention infographics in English and Spanish that anyone is welcome to just grab and go, take that information and share it however you'd like. We would love to see that. We are also working to present to local groups. We'd be happy to present to your group, anyone who is listening and would like to hear more about COVID prevention. We're also educating through the ambient environment and using social media and print media to spread our messaging. Yeah, and also for all of you listening, those who are here listening to the update today, and those who listen to the updates regularly, I would encourage you all. You're clearly educated and concerned citizens, and I would hope that you all take it upon yourself to normalize and just share what you all are doing to prevent the spread of COVID-19, what practices you are adopting to prevent the spread of COVID-19. I also would encourage folks to have a plan for the coming holidays, whether you're celebrating Dia De Los Muertos or Halloween, or whatever your celebrations in the coming months are. Have a plan for how you're going to do that safely. I know that there's a lot of peer pressure sometimes to not, people say, well, why don't you hug me? Have a plan in advance so that you can celebrate safely. And also please have a plan for, God forbid, if you do test positive and you have to isolate, make sure that you know how you can do that effectively. It's challenging to stay home for 2 weeks. Have a plan now, just in case. If you would like to get in contact with me, I'm more than open to it. I'd love to talk to people. My email address is lkramer, LKRAMER, @ncoinc.org. And you can visit the webpage that I mentioned before on Healthy Mendocino's website. Thank you.
Thank you, Lucy. With that, we're going to go over to our health officer, Dr. Andy Corin, to give you an update on COVID-19 in our community. Andy?
Thank you, Sarah. Thank you, Ron. Thank you, Lucy. We're all in this together, and so I'll get down to some of the other things that I'm aware of going on around the county in a minute, but I'm going to start now with the data. I think a lot of people want to know. The total as of October 1st in Mendocino County, there are 971 cases. 612 of them, or 63%, are in our Latinx community. There are 241 people quarantined and 115 people who are isolated at this point. Hospitalized are 9 people, of whom 3 are Latinx community. Let me just sign in here if I can again. Well, I'll do this blind. 3 are from the Latinx community. 1 is in the ICU, and that is a Latinx person. Hospitalized in Mendocino, of those 9, 6 are here in Mendocino. 3 are out of county. There have been 19 deaths so far in Mendocino County. The most recent was a 51-year-old white male who died at UC Davis after over a month of suffering respiratory, renal, cardiac disease. And you can see at 51 years old, he's a young man, he's a young member of our community, and we mourn his passing. Our case rate, 7-day average over 7 days ago, has risen to 12.86, and it's gone up each day that I look at it. That is doubled since 2 weeks ago when I spoke to you last. So we continue to be in the purple tier of the governor's framework for reopening. We are widespread and the most restrictive tier. There are some changes, though, that have come from the state. Personal care services are now open, and some of them can be given indoors. Public parks have been allowed to be opened by the state, but in Mendocino County, it depends on the personnel that we have in our cities to monitor them, because there are safety rules around doing that. So I encourage people to call the agencies that manage those public parks. Why is there such an increase? Well, we know we're still in the surge from Labor Day, and gatherings is what we point to, but gatherings can be big parties and they can be very small parties. As much as 2 families who are not in the same cohort, a group of friends is a gathering. They cross over, and if one member has the COVID, they may have no symptoms. They may be pre-symptomatic, but they can pass it to the other people in the other cohorts. Other ways that this can happen is driving to and from work. And as others have mentioned, it can be just partying, just getting together with an old friend. And that is one of the reasons why we have these increases at times of holidays. We have also had outbreaks. Last time I spoke about the Ken Fowler outbreak. And at this point, we know that there were 21 employees there who were infected. Recently, we've had outbreaks in Covelo and Point Arena, and our case investigators have had some problems with people being afraid to answer questions or not being thorough which workplace they came from, what schools do members of their household go to, and this impedes our ability to control the spread of the infection. So we've been working closely with the Latinx community as well as Native American tribes in Manchester, Point Arena, and in Round Valley, as well as the California Rural Indian Health Bureau. I also want to call out an excellent job done by our clinic partners in Round Valley Clinic. Through their case investigations, contact tracing, and follow-up, they have reached out and found, it's almost 90 people and 30 households were involved. They had 100% cooperation from the people they called, and that's due to knowing their community and the trust they've built up before and during this outbreak. And I just want to say this is excellent work. And please, if you're called that you may be have been in contact with someone who has had COVID, please be forthright and complete in trying to remember all of those that you've had contact with. That's the only way we can wrap around these outbreaks and bring this under control. One thing I'm sure you've nearly all heard about is that President Trump and his wife Melania were recently tested positive for COVID, and there may also be possibly early symptoms that they're showing. We wish them a rapid recovery, but also I wanted to say no one is spared from this. Defend yourselves and your families with masks, 6 feet of distance, and hygiene measures. The risks are real. These are health orders, but really compliance is dependent upon personal choice to mask up, to maintain that distance, to wash your hands frequently, sneeze into your elbows. All those advice that we give, some of which are orders, they depend upon you. These are our weapons in this battle. It's a small sacrifice, but it protects our family and our communities. If we all commit, I think we'll be in a red tier, which will start to open our economy. So for those people who are very stressed and down and depressed, this is going on for a long time. We've talked about this in other media events. We have a warm line that is open from Monday through Saturday, 7 to 6, and that number is 472-2311. Again, 472-2311 for people who are stressed and want to talk to a professional, a counselor. Also, if there are questions about health orders, lab results that haven't come through that we can check on, other kinds of questions like that, we have a call center that is open Monday through Friday, 8:30 to 5, and that number is 472-2759. I want to point out also that there have been a lot of positive efforts. So OptumServe has been increasing in their testing. We want to encourage people to test, test, test. I heard recently that fear is a good motivator for being tested. Yeah, it is. Please test. Go to OptumServe or your clinics, ask for the test for COVID. We've also changed OptumServe to Sundays starting this Sunday so that it can be a family day. Many people come into Ukiah to church and so forth. OptumServe is now available on Sundays. The Hispanic community is distributing masks door to door, and they're educating about COVID recommendations. The lodging industry on the coast is also stepping up and starting to do testing of their employees and communities. And we're working with them to figure out what testing modality works best. Many of the folks that work in the lodging industry and all of the other industries around our county who are essential to those industries are from the Hispanic community that is so disproportionately affected by this epidemic. And so we thank the lodging industry and the others who will be involved. And I know that there are others from the chamber and others from elsewhere in industry who want to do this. In the future, please try and remember to be prepared, for fires have not gone away and the smoke is still there, and coming may be some power outages because of our PSPS. So avoid, if you possibly can, moving in with other cohorts. You want to stay with your own family, people who you have been in contact with, and not mix families because that mixes germs. Also, if you need to be home without power, think about filling your propane tanks, getting batteries for your flashlights, and so forth. Secondly, influenza is around the corner, and we're trying to desperately avoid a twin-demic. Masks are important, plus flu shots. The best way to avoid the flu is a flu shot. You can get these at your private clinics, your doctor's offices, pharmacies, and for those who have no means to pay, the Department of Public Health will have some walk-in clinics later on in the month. So the next thing I wanted to talk about was Halloween and Dia De Los Muertos. It is going to be different this year. I think you all know that, but we want it to be a fun time for the family and for the children. There are high risk, lower risks, and low risk activities, and I want to go through some of those. I want you to be thinking about maintaining masks and maintaining distance and not mixing cohorts. So the highest risk activities are the traditional trick or treat, trunk or treat is a new addition where people go around to the trunks of cars. But the problem is congregating of children and their family members at the doorsteps and congregating around the cars, and we really advise against that. They're screaming at that time, happy and sometimes frightened, but it's not good for passing the germ, which really is frightening. And of course, avoid alcohol and drugs because it lowers our control and we yell louder and we spread germs more. Lower risk activities that I'd like to encourage people to do are things like decorating pumpkins, houses, decorate your masks. Try not to mix Halloween masks with your COVID masks, but you could get a COVID mask that is Halloween-like, or you could even paint it or color it or magic marker it so it's a little scary or whatever you want to do. There's virtual opportunities now that we've gotten used to over the last several months. So do a virtual costume party, do virtual dances. Someone suggested the Michael Jackson Thriller and having the kids dance in front of the computer and share that. People can drive or walk around town with their children to check out house decorations still. There can be scavenger hunts, take pictures of what you find, don't necessarily pick them up. Some community groups are being very creative with some parades to have children come by and pick up pre-bagged candies and do it in a safe way. Another group is having a maze in a cornfield that's open and carefully spaced so people don't congregate inside the maze. We're asking cities and organizations to plan more events. Again, make this an exciting time for children. As far as Dia de los Muertos, there are family recipes that can be cooked and safely delivered to neighbors and elders who may need them, but do it safely. Masks can be created, virtual celebrations, visit graves of those who have passed, make altars, music in honor of loved ones. There are many activities that can be traditional, and we're having to change some of the traditions because of the infection in our community. And so I wish everybody is going to have a good holiday season. We'll be talking more when Thanksgiving and Christmas and New Year's roll around, but the COVID epidemic is real, and we don't want to lose any more people to it. So I'll close now and open it for questions.
Thank you, Dr. Corin. We're going to get started on some questions with the media. For our watchers online, feel free to leave your questions in the comments, and we'll try to answer a few of them towards the end. So I'm going to start with K Mudd, who submitted their questions electronically. And the first one is, what sort of trends are Mendocino County seeing in positive cases amongst various sectors of the local economy? Are cases more common amongst service industry workers, healthcare workers, agriculture? Does one sector stand out as more prone to infection? I believe this question's for you, Dr. Corin.
So I don't have specific answers to that. I can say, and you can see that among the Hispanic, the Latinx community, it's very high. And so that would encompass the agricultural workers. It would encompass people who are working in essential jobs, doing things like cooking food, maintenance work, and so on and so forth. They are our essential people. As far as individual workplaces, we've had a number of epidemics, and I can't say that there's actually a trend in terms of where those epidemics are happening. And so, you know, I think just everybody has to be aware.
The next question is, many have spoken of a potential fall or winter surge. What does Mendocino County foresee happening as cooling weather approaches and possibly wetter weather? And what steps can be taken by residents to mitigate that surge?
Well, of course, with cold and wet weather, people are going to want to be indoors. And being indoors is much less safe than being outdoors. And unfortunately, we haven't even been able to be outdoors very much because of the air quality and the fires. It's been a contradiction. But as we know, we're going to have to be moving indoors. People are going to have to make some arrangements to increase their air flow inside. That will decrease the spread of infection. Hopefully we'll make our way into the red tier and be able to open things like restaurants, but it will still be at a very reduced capacity initially. But when you're indoors, you want as much air flow as possible. In the meantime, we're going to be living and playing and working and learning in cohorts. And so start thinking about, what are we going to do with the cohorts? What are we going to do with small groups where if one person does come in contact and develops the COVID infection, how do we trace and control that so it doesn't jump to another cohort? So there are less and less people who are involved. And if we can do that effectively, and we do that with masking and social distance and hygiene, and being very careful not to travel to and from work, to and from the store with people who may be outside of your cohort, then I think we'll get it under control. There will be more cooking at home, and there's a good thing to that. There will be some takeout. There'll be, as long as we stay in the purple, there's not going to be eating inside. Eating is one of the most dangerous ways to transmit the infection. It's been shown over and over in the literature. So when you take off your mask and you put food in, you cough a little bit, you clear your throat, that's where the droplets come out and the germs come out. So there'll be less social gathering around Thanksgiving and Christmas and so forth, except for within cohorts. So start planning on that.
Next, we'll move over to KZYX, Sarah Reif.
Yeah, thanks for having this event today. I'm wondering if you can talk a little bit about the state reopening rules about the equity metric and how that will affect Mendocino County's reopening, and what we're doing to satisfy that. It sounds like some of the reopening will be contingent on bringing down the positivity numbers among the Latino or Latinx communities.
We are in a smaller county, less than 100,000. I think it's 106,000 is going to be the cutoff, but we're closer to 90,000 in our community. And so the case rates are not as much the target for us, although it is a target for us in general. What they want to see and what we want to do is target our energies toward the disparities, which in this case is the Hispanic community and the Native American community that is showing up more and more positive in our statistics. And so that's where we have an emphasis on the bilingual presentations that we do. I've gone to a few community meetings. We're involving the community organizations to take it on, and they're doing an excellent job. And so these are some of the things that I think will be heavily in our favor. In addition, we are hiring more bilingual personnel and bicultural personnel, and we have plans to do that not just for COVID, but for our entire Health and Human Services and county government. And this is something that we need to do despite, or in spite of, not in spite of, but in addition to the carrot that's being held out by the state. It's something we've needed to do. This is a very important part of our community. And unfortunately, disparities in healthcare are only uncovering disparities that we have in employment in our community and other issues around housing and food availability and so on.
Thanks. And a follow-up to that, I'm wondering how targeted these efforts are. It sounds like NCO is doing a lot of work, so maybe this is a question for both you and Lucy. But I understand that the city of Ukiah had some maps of hotspots and which parts of the more populated areas had higher numbers. And I understand that those can't be publicized because of people's privacy rights. But I'm wondering if there is work being micro-targeted to neighborhoods that have been especially affected.
Let me start, and then Lucy, I'd like you to help. The maps that you're talking about, geo-mapping, it got a lot of publicity initially, but those areas that were hotspots move around. There's not as much consistency with what neighborhoods that affects. However, we have people who are from the community who know areas where it's important to get the information out, because most information is in English. Most of the culture that we have, that's the problem with disparities, goes out through English Anglo channels. So when there are people in the community from the Hispanic community, and they bring it into their community, it's much better received and it's much, much better targeted. And that's where we're putting our efforts. And do you have anything to add, Lucy?
Yeah, I really appreciate that answer. I totally agree. I think I know our top priority is ensuring that Latino people hear this messaging from people that they will listen to and want to listen to. People need to hear this from their peers and neighbors, of course. But to answer your question, yes, we have been doing micro-targeting and identifying neighborhoods and regions throughout the county where Latino people live, more, areas where there are many Latino people living. And then we're targeting those neighborhoods for our door-to-door outreach. Also, when I say door-to-door, we have a safety plan in place to be able to do that effectively while reducing the risk. It's a great question, and I think, as Dr. Corin said, what's most imperative is that the individuals who are delivering the message are the appropriate people, and that the language is appropriate, not just that it's in Spanish, but that we're including appropriate colloquialisms and that the messaging is culturally relevant and palatable.
I should add a couple of other things that we've done within the county. For one thing, we have purposely moved the OptumServe day to Sunday. Sunday is a time when many people can only get off and go to church, to Ukiah. And we're hoping that Sunday will be a day that OptumServe will be well utilized by the Hispanic community. In addition, this broadcast right now is being translated as we speak. So that was a big effort. We tried to put me on doing Spanish the last month or so, and I tried, but in reality, it's much better to have somebody who's fluent and can translate real time.
Yeah, and I would also add one more. Likewise, our work, we have been targeting faith-based organizations and doing outreach specific to churches as well. That's a good point. I agree.
All right, thank you both.
Thank you, Sarah. Now we'll move over to Jackie Orozco with El Punto. Jackie?
Oh, hi, thank you. Sarah, do you want me to ask the questions in Spanish or English?
Whatever you're comfortable with.
Okay, I'm going to do it in Spanish. So Ricardo can translate it. Okay. Buenas tardes. La primera pregunta, doctor Coren. Usted ha estado hablando de que muy pronto quizá podemos tener una doble pandemia, combinada con COVID y con la influenza. ¿Cuáles? Ya mencionó usted de que probablemente se hagan algunos eventos para vacunar a la gente. ¿Tienen alguna idea de cuándo podrían hacer estos eventos y más o menos han planeado como qué horarios?
Andy, you're muted.
Ricardo, can you translate that so I can hear it and I can be as complete as possible? Sarah, I think you're going to have to make it happen.
Ricardo, can you toggle over to the English side?
Jackie, creo que está preguntando dónde puede recibir las vacunas toda la gente.
Sí, ¿sí? Y cuándo, Andy, y si saben como a qué hora lo van a hacer y cómo van a hacerle saber a la gente que va a haber estas jornadas de vacunación.
Ok, pues los mejores maneras para recibir las vacunas es desde sus médicos, clínicas, farmacias, pero para ellos que no tienen dinero para pagar, no tienen aseguranza, vamos a tener algunas clínicas aquí en Ukiah y también probablemente en el Coast para gratis. Pero no tengo ahora las días ni las horas. Pero cuando tenemos, vamos a publicar.
Ok. ¿Podrían considerarlos, tenerlos después de los horarios, cuando la gente sale de trabajar por las tardes?
¿Por las noches, por ejemplo?
Por las tardes después de las 5 o las 6.
Gracias.
Okay.
Yo voy a hacer esta recomendación. Eso es muy importante. Y es posible, voy a preguntar si es posible, debemos considerar como domingos. ¿Es mejor, creo? Yo voy a hablar con ellos que está haciendo y vamos a tratar.
Okay. Sarah, is Ricardo available?
Yeah.
Okay.
Yeah, Andy, at the bottom of your screen, you're going to see a globe. Select English.
Okay, great.
And you'll be able to hear Ricardo when he goes over.
Okay.
Thank you. Gracias.
Sarah, my second question is for the Willis Chamber about the Mascot Mendo program for businesses.
Ron, have you selected the English feature?
I have, but could you repeat it, Ricardo?
There you go, I did.
Okay. La pregunta para la Cámara de Comercio es...
The Mascot Mendocino program?
Sí, para el Mascot Mendo, para el Chamber of Commerce.
I selected the English, but I'm not hearing her.
Okay. Okay. I'm going to
Oh, so,
try to.
okay. I did not hear the
Okay.
question, Ricardo. Sorry.
Ok. La primera pregunta, con este programa se trata de darles a los negocios a cubrebocas y gel para desinfectar las manos, gel desinfectante. Sabemos que muchos negocios que son de propietarios latinos, ellos no están inscritos en las cámaras de comercio. Yo sé bien que cualquier negocio puede aplicar para tener los cubrebocas y el gel, pero ¿qué otras estrategias están haciendo para localizar o contactar estos negocios de propietarios latinos que a lo mejor ellos no hablan inglés y no saben de este programa?
We have recognized that. We are looking at employing or getting individuals that are able to do that for us. Our messages are out there in Spanish, and we're hoping that the Spanish-speaking population would be able to hear what we're trying to say about the program. But any recommendations certainly would be appreciated. We will do whatever we can to make sure that we get masks and hand sanitizer out to any business that is interested in getting that. So we will be a little stronger in that side. So yes, we will look at it for a little stronger program on that side, but we do have it.
Thank you.
Thank you, Jackie. Moving next to the Mendocino Voice. Kate, are you on the line? You're muted.
Adrian's here.
Oh, hello, Adrian.
How you doing? Thanks for having this, and thanks for the translation today. You guys are doing a good job of always improving this conference. If I could ask a clarification first, Dr. Korn, you said that there were, I heard you to say that there were 90 cases in Round Valley on the Round Valley Reservation. Was that correct, or was that 90 potential cases? Because the data graphic still only shows 62 Native American people having contracted the virus.
No, it's 90 people were contacted through case investigation and contact tracing, as well as follow-up. It was a general, the amount of work that this clinic has done over just a few days has been very impressive.
Yeah.
Is that clear?
I think Jack might still have her.
Adrian, were you able to hear me?
So 90 people.
90 people were
Yeah, I
contacted,
heard you.
about 90 through contact investigation, contact tracing, and follow-up, which involves finding out what they need to be at home safely. Some people need additional resources, and these contact investigators and tracers follow up on all of that.
And do you have numbers right now specifically for the Round Valley Reservation in terms of infection and quarantine?
Becky, do you have that information?
Good afternoon, everybody. It's my understanding that we have, at this time, we have 14 individuals that are in isolation in Round Valley and have tested positive for COVID. The remaining individuals have been contacted, as Dr. Korn shared, close to 90. So that's another 70, or let's see if my math is off here, 76 individuals, sorry, that have been contacted as close contacts and to evaluate and determine if we need to place those individuals into quarantine and next steps for supports for those family members and individuals.
Thank you. So moving on to the questions. I was wondering if you could talk about it. It does look like case count has spiked pretty significantly. If you look at like the graph, I just realized I don't have my camera on gesturing. If you look at the graph, there was a big spike in the summer, and then it was very steadily trending down, and it's begun to spike back up. I wonder if Dr. Korn could speak to where you think that spike is coming from. Is that sort of a drawn out, delayed Labor Day thing? Is that perhaps related to the evacuations and the need for people to sort of clump together during that? Do you have any information that you're getting from the contact tracing that can give you a kind of etiology for that outbreak, or those outbreaks?
Well, I think that the surge from Labor Day is continuing. It's not that it goes away the week after. In fact, we usually start seeing that after a week, and the case positivities come up over the next 2 weeks. We have had very smoky weather and fires, so people have moved into other households, or they've had to use the same cars grouping to travel. There's many situations like that which we really can't pin down, and they remain community contact, which is kind of vague. And we've had other outbreaks that have been named. As I said, there was Ken Fowler. There have been others as well. I'm not going to go through the individual ones, but they're also in the north and the south of the county. So those all pull together, and we're trying to do what we can to surround them with the contact investigation, tracing, and surveillance testing in those communities. Those are essential functions that we have. But have we put them together? We are trying to do that. We're analyzing that data and trying to see, is there a certain specific thing? And it still remains community spread. In other words, wear your mask, keep 6 feet apart, the basics. Those are our weapons.
Right. Yeah. I mean, it sounds like we have to just remember that this is a ever-present threat, and we can't get lulled into a false sense of security when the case counts go really low, because that's precisely when people start to become more lax, and then the case counts go back up.
Exactly.
Related to that, I was wondering if you could elaborate a little bit on just what the guidelines are for gatherings, especially now that we're coming into the holiday season. I know you touched on that a little bit before, and some recommendations about how to avoid transmitting, but specifically having to do with what counts as a cultural. I know the state's guideline is that free speech and cultural ceremonies or religious gatherings are allowed. I think cultural ceremonies was meant to be an umbrella term for sort of funerals, potentially weddings, but does that extend to a Halloween gathering, a Christmas caroling, which of course involves singing? Like, what are the boundaries for what is defined as a cultural ceremony? And if you could just give us a little bit more guidance and guidelines around what is allowed, not just what's a good idea, but what is actually going to be allowed. What can somebody
Going to be, I can't tell. I don't know what's in the future at the state level for sure. But at this point, we'll define gatherings as if 2 different household units are mixed. So it could be large households, small households, it doesn't really matter. There are some household mixtures that are possible under the cohort definitions. So if you are a household group that depends on each other for ongoing activities, childcare, you need to shop, you need to get to or from work, and your families are always mixed. You are one household unit, and we try and keep that to under 16 people. Within schools, cohorts are defined as 12 students plus 2 supervising adults. After school activities and childcare, it's a similar kind of division of cohorts, so that if one person becomes sick, we may have to quarantine the entire cohort, but it's not the entire county, and it's not 2 or 3 cohorts. In workplaces, it's especially recommended that the workforce in a particular industry is divided up into work cohorts of 6 people or less, But even if it's a small organization, dividing it into 2 cohorts would try to ensure that the work of the organization could continue if one of those 6 people became ill. Does that clarify it more? At this point, I have no word that Christmas caroling is going to be permitted. Christmas caroling is singing, and that is a high-risk activity. It's a lot of fun. It's wonderful. Love to hear it. I don't do it myself, but it's the risk is spread, and that's what we worry about.
Sure. What I was referring, I used a somewhat exaggerated example. Sorry about that, by bringing up Christmas caroling. But what I was wondering more so is the state's definition saying that gatherings are permitted for protest and for religious or cultural gatherings, and I think that was meant mostly to deal with Sunday service, mass worship, and funerals. But would that include like other kinds of large gatherings that aren't necessarily religious in nature for the coming holiday season, or for weddings, or anything along those lines? And if you could just describe, I think I've heard a lot of people say a lot of different, or get a lot of mixed messages on this. And a lot of people there's sort of the rumor version that goes around, especially on social media, about what is a gathering, what is not. So I was just wondering if you could clarify that, so that we'd have the definitive version of what is a cultural gathering, how big can it be, what fits into that rubric.
So let's separate 2 things out. One is gatherings, which we've talked about, and the other is cultural activities. And so I'll try and give you an example. You've mentioned several of them. One that was initially left out in the thinking was, for example, quinceañeras. That's definitely a cultural activity, and many people did not realize that it also has a religious component to it, and that has been included. However, you'll notice that with weddings, there can be a wedding service, but not a reception, especially that involves food, and that we really try and keep those weddings so that, and even cultural events, even in church, so that they are as safe as possible, maintaining cohorts, maintaining social distancing and masks. So, we from a civil rights constitutional point of view, we want to respect the need for people to protest and to carry on their social and cultural activities, but within understanding that there is an epidemic, and to give guidance to do it safely. And that's about as much as I can give you. Going forward, I don't know if there will be some loosening of that, and it may be dependent upon the tiers and what tiers we're in. I certainly hope we can get ourselves all the way down to red or even orange, so that we can have some more religious activities, more family activities, and things like that. But at this point, the first and foremost thing that we're doing is trying to break this pandemic down. And within that, we still want to honor constitutional rights and religious rights and freedoms.
Thank you very much, Doctor. Thank you for indulging me in asking about those specifics.
Thank you, Adrian. I see one question from our viewer wanting to know if there's more information about the Point Arena outbreak that you could share.
I can say that we are working vigorously with the Indian Health Service in Santa Rosa, their clinic, with the tribe, and with our clinic that is in Point Arena, to complete surveillance testing, contact tracing, and investigation. I don't know enough to be able to reveal names or anything else at this point. That's ongoing. We've done an awful lot of testing. People came out in Point Arena in the dozens. I think over 100 came out for testing, not under 100. Tell me, Becky.
So for the testing event that Mendocino County provided, there was just under 100 individuals, and in partnership, AB Med did testing on the reservation, and so it did bring that number over 100. So I apologize for that confusion there on my part, Dr. Corin. And additionally, just while I have it, I would add that we are doing testing again tomorrow in Point Arena, as we did have problems with the testing that Mendocino County did. And those samples ended up, all of them resulted in being invalid. And so we have reached out to those individuals that tested and are continuing that outreach effort today and encouraging them to come and get tested again tomorrow, and have coordinated that effort with the lab to do our best efforts to make sure that doesn't occur again.
And
I was just going to clarify the error.
How many people so far from Point Arena for the outbreak? How many people?
So we have had 8 individuals in Point Arena area that have tested positive.
And I was going to clarify that the difficulty that we had with the samples actually had to do with the laboratory storage. And it was not a responsibility of the people who were obtaining the samples or delivering the samples. Things happen. And this was a real big problem, and it costs a lot of valuable time. It may be that because we did not find any positives in that run of samples, that there will be no more positives in the next, but it's an unreliable sample. So we don't want to hang our hats on that and say everybody is safe. We really want to do those testings again.
And we'll end with one more question from one of our viewers. It's kind of long, so I'm going to condense it. So they want to know what kind of support is being offered to families who are under quarantine or in isolation, and during our contacting process, are we connecting them with other nonprofits or organizations like the school district to provide additional resources to those in quarantine and isolation?
Becky, do you want to answer that one? I think you're more informed.
Certainly. So we have several supports for individuals that are in isolation and quarantine. We are certainly now connecting them with schools that are doing food delivery program for those individuals that are isolating or quarantining in their homes, so they can be added to those food delivery programs. We have resources within Ukiah that we have been partnering with, both with NCO and with I can't get past the Chamber of Commerce, and it's not the Chamber of Commerce. It's the, I'll get to that one. I apologize. Additionally, we have been delivering food to various individuals that weren't able to get meals in their own homes. And for people that cannot isolate or quarantine in their own home, we have made arrangements for alternate care sites to be able to ensure that those individuals are able to still keep their family members safe. And at the alternate care sites, we are providing them again with food and support and care to be able to support not only those individuals that are in isolation or quarantine, but also so that they can help keep their family members safe. And I will get that other resource, Sarah, so that we can add that later.
Thank you, Becky. So that concludes today's Friday update. Before we go, I just want a couple quick reminders to the public. Our OptumServe hours have changed. Again, it starts a new time period this Sunday. We're now open from Sunday to Thursday, 7 a.m. to 7 p.m. You can make an appointment at lhi.care. Go ahead or walk in or call 888-634-1123. Our call center number has been updated fairly recently. So that number again is 707-472-2759. Our next COVID-19 Friday update will be on October 16th at 2 p.m. And our Board of Supervisors meeting will be streaming here on our Facebook channel on October 6th. And we'll be providing another COVID update during that time period. With that, thank you for joining us today. Have a safe weekend, and we'll see you soon.